Good morning. My name is Eugenie Birch, and I am a professor of city planning at Penn Design and also co-director of the Penn Institute for Urban Research, a group on which Dean Melise sits on its executive board. I cannot tell you how exciting this meeting is. I cannot tell you how important this meeting is, because whether you know it or not, you're part of a very important trajectory of creating new knowledge and new practices for our students, for the people whom we touch, and for the professions in which we are part, whether it be the health professions or the city building professions or the social work professions or whatever. This meeting is extraordinarily important. And let me give you a little history about how it began. About 3 years ago, Dean Melise invited to speak at Penn a very prominent woman by the name of Dr. Vivian Pinn. I think her name may be familiar to many of you, but if it's not, Vivian Pinn, for the past 20 years, has been the founding director of the NIH's Office of Research on Women's Health. And for 20 years, this group has been engaging in women's health research. But when she came to Penn, Dean Melise suggested to her that, of course, this research was of extreme and vital importance, but there was something missing. Vivian Pinn said, what? And she said, what is missing is the sense of place. That we must begin to think about women's health issues with regard to where women live. And in particular, we need to think about women's health issues in cities, urban women. This began an initiative at Penn Nursing, which started with a small conference 2 years ago that focused on urban women's health in the United States. A year later, Dean Melise and her associates, particularly Eileen Sullivan-Marks and Carolyn and many others, said, this is not enough, we need to think about the world. And they convened an extraordinary conference on cities and women's health that brought hundreds of health professionals and people involved in city building activities together in one place to discuss not only the depth of the health issues that we confront, but also the breadth. This conference will yield a book called Cities and Women's Health, which will come out next fall, which will discuss these matters, and has launched the social media activity that you heard about earlier from President Gutman, has been part of the initiative of the global convention that you heard about with the UN and the partnerships that will develop through that. And next year, there'll be another conference that's going to build on the work that this work has done, which is a cross-sectoral discussion of health. And in fact, in this discussion, there'll be discussions of food security, of urban transportation, of water and public health, and so forth. But it will bring together people from different disciplines. It will break down those silos, just as you are breaking down those silos here today, which is representative in the panel that you are going to hear right now. And the core piece of this conference is based on what we're hearing today and what we're doing today. So we need to thank Dean Melise's leadership in this. We need to go deep, as we did earlier this morning, and now we need to go broad. We need to understand what a city is and how its physical, social, and economic conditions affect women's health. So what is a city? I feel like I'm going to call on somebody in my urban class 101. Please define a city for me. Well, I won't do that. But the traditional definition is that a city is a large, dense place that has a heterogeneous population. What does this mean? Well, we're going to hear about this on this panel. But before we do that, we need to understand the huge role that cities are playing today and will play in the future in the world and the nation's economy. Did you know that in the United States, the 100 top metros produce 75% of our gross domestic product? 75%. And in the world, according to the McKinsey Institute, the top 600 cities out of about 2,000 produce 60% of the world's GDP. But these economic machines will not continue to progress and grow if we don't pay attention to the people who live within them and the issues which they confront. And foremost among them are the issues of women's health. And that's what we're going to talk about today. Our speakers are going to take you into the world of city building and discuss the relationship between the health issues of women and what cities look like and act like and how they're built today. We have 3 phenomenal experts to talk about this. On pages 8 and 9 of your program, you'll see full descriptions of their backgrounds. But our first speaker is Margaret Castillo, who is president of the New York American Institute of Architects and has been a leader in convening multi-sectoral discussions around what we call, or she calls, the fit city. She will tell us about that. Our second speaker is Claudia Adriazola-Delgado. Claudia is going to take us into the world of transportation and safety on roads, because after all, if we don't have an infrastructure that works for women, we have problems. And lastly, Anastasia Posadskaya-Vanderbeck will talk about violence in cities. Remember, we told you cities are large, dense, and heterogeneous places. These are the places that make the economy work, but they also create some of the issues that we confront with women's health. Let's find out how we're going to solve them. Margaret.
Thank you, Jeannie. Thank you for inviting me here. I think to start the conversation, what Jeannie said about cities is so important because for the first time, more than half of the world's population lives in the cities. This is our future, and this is something we really have to address. It was interesting that the name Jane Addams came up this morning because we could start 100 years ago with looking at infectious diseases, the density in New York City in particular, the inadequate systems for garbage, water, sewer, which led to the health issues, tuberculosis, cholera, and fever. But through planning of cities, we really eradicated those diseases. In 1842, a New York water system was established. In 1958, New York City created Central Park, the lungs for the ventilation for the working man's lungs. 1881, the Department of Sanitation. Tenement housing in 1901 banned dark, airless apartment buildings. 1904, subway extended the population so people could live in the Bronx and further northern Manhattan. 1916, we had zoning ordinances, setbacks to allow light and air into the city. These are all planning and design mechanisms which really impacted eradicating infectious diseases. Now, 9% of the deaths in New York are due to infectious diseases, 75% are chronic diseases, diseases like heart disease, diseases that can last a long time and are affected by lifestyle. So our question is, can urban design address today's health epidemics? Just like in the 19th century, we now believe in the 21st century, chronic diseases, sometimes called diseases of energy, can be shown that with effective design solutions, there is a health parallel as well for sustainable design solutions. The obesity, which I'm sure you all are familiar with, from if you look at the charts from 1985, when the largest category was 10%, we are now at 30%. And the enormous health cost to this, now attributed to $147 billion. If the trend continues, they're projecting by 2030, 86% of adults could be overweight or obese, and the cost would be $860 billion a year. The risk factors, we're looking at a poor diet. We talked about the food, TV watching, and inactivity. Through physical activity, we're uniquely positioned to address through broad interdisciplinary approach. And we think that the city's fabric, the work of designers, planners, is directly related to physical activity and therefore the chronic disease solutions. So what we think is people have not changed, but our environment has. If I had slides, I'd show a picture of stairs leading to a health facility with escalators, and everybody would be on the escalator, no one would be on the stairs. We've really been designing physical activity out of our lives for decades. When you walk in, it's an elevator. You have to look to find the stairs. We think design can make a difference, and the Center for Architecture here in New York worked with the design of Department of Design and Construction and produced an active design guidelines, which is on a website. And through design, we show that with evidence-based design, we can actually increase physical activity. If we look at the city as a whole, and if anyone's been traveling in New York through our bike lanes, which was a tremendous initiative by the city, and is rather controversial, but from a health benefit and actually from a city street, world-class street benefit, it is really amazing and terrific, the benefit. The ridership has been up of cycling 28%. We have many conferences, as Jeannie said. Our Fit City conference, we'll have one in the spring. It's the 6th year. We have people from Europe sharing best practices. People talk in Europe that people that are older cycle, more women cycle, and this is not true here. So the implementation of this bike lane is incredibly important that it becomes interconnected and separated from the traffic so that people feel safe. People that I don't think understand the health benefits of this tremendous initiative. The plazas that we've also created in New York is another initiative to get people out and walking. We brought our Fit City to Fit Nation in Washington, D.C. In February, and Councilmember Tommy Wells said, I get it, it's the livable, walkable city. You can either have buildings that turn inward or you can have them turn outward with cafes. If it's more pleasant to walk down the street, people will do that, and if they're destinations. This has to do with land use planning and initiatives of density and what happens on the street, and that people live and work in close proximity. I think you all know that walking is a wonderful exercise, and through design we can make that, encourage that, make it attractive, and have people on the streets. In terms of women, to make it safe, the more eyes you have on the street, it makes it safer to walk in the neighborhood and get out in the evenings to walk. If it's dark or they're abandoned storefronts, it's much, the feeling of insecurity makes a difference for women to be out on the street. The bicycles, we've shown also have a separation, and these are incorporated also with medians in the street. In New York, sometimes there are many lanes of streets, so for the elderly to cross the street, it's very difficult to get across, or people that are impaired. To have these islands in the middle, and if they're planted, so much the better. It does have less cars on the street, but we brought the former mayor of Bogota to the conference who said there isn't a constitution in the world that says that you have a right to a parking space. With that, on the inside, the stairs are really signature element to make them visible, grand, encourage that. That's the first thing you see, and connecting floors is so important to design. But I'll stop there. Thank you.
Claudia, you're going to take it to the next level.
Thank you very much. I'm really grateful to be at this conference and represent my organization. It's the World Resources Institute. It's an environmental think tank based in Washington, D.C. We have almost 30 years. And my program is called Embark. We have almost 10 years working in 4 countries and 1 region. We work in Brazil, Mexico, the Andean region. We are based in Peru. And we have also centers in Turkey and in India. So, and what is what we do? People call us the city fixers. So we support cities in developing countries to have a more sustainable transport and sustainable urban development. And that matters for environmental issues, is true, but it matters a lot for health. If we see the statistics, we can find that there is a very bad, very dysfunctional relationship between health and transportation and urban development. We are looking at 1.3 million people dying every year for traffic accidents, 2 million people dying for bad air quality, and 3.2 million people dying for physical inactivity. This is really tremendous. And I would like to make a pause here about physical activity and reflect a little bit with you what can be done that is really feasible, right? We are talking about 30 minutes of physical activity, which is what the World Health Organization recommends to decrease the risk of coronary heart disease in 50%, the risk of diabetes or obesity in 50%, hypertension around 30%, cancer, colon cancer, breast cancer, 50%. Having only 30 minutes of physical activity per day can help develop bone mass, deal with osteoporosis, improve balance, coordination, mobility, increase self-esteem. And now, if we see our women in the cities that have a full-time job, have 2 children, how you can ask them to go to the gym and spend, an hour commuting there and then an hour in the gym and paying for that? Well, we have found that the city, as Margaret was just mentioning, can provide that in a very easy, simple way. Go walk to the bus or walk to the metro. If you have bike paths, take your bike, take your children in the bike, don't put them in the car and drive them everywhere. And you are going to be really having a huge impact in your health. Now, this is simple to say, but in our experience in the field, in developing countries, cities almost ban you for doing that. It is not possible to find sidewalks. The quality of mass transportation is really poor. Don't dare to bike because it's almost suicidal. So we need to do something. We use an approach that is called avoid, shift, and improve. Avoid, first of all, we try in a city to have enough dense city with everything there so that people don't need to really travel, first of all, because it's where the risk starts. We have a lot of statistics demonstrating that there is a direct correlation between risk, a traffic accident, for example, and the number of vehicle miles traveled. We support shifting. Shifting means to go instead of the private car to the mass transportation, but that has really high quality. And as you can see here, this is something called BRT, is Bus Rapid Transit. Is the systems that we prefer to support in developing countries because it's definitely much cheaper than having a metro. The correlation is almost 1 to 100. What is a BRT? Are articulated buses that runs in segregated corridors and that basically mirror the features of metro, but on the surface. These type of systems can have around them enough safety for commuting and getting physical activity, because you have to walk to the bus station, and around that you can have feeder routes that can help you use bicycles, for example. and then improve. And if we can go to the next slide, there is always ways to improve the design. Here you have one of the examples. This is a road safety audit in a BRT corridor where you can see the sidewalk being redesigned to be perpendicular and with an island that can protect more people. If we go to the slide before, you can see that all this is not only about putting buses in a city, it's about getting sustainability and getting co-benefits out of that. So I think my time is done, but I will welcome questions. Thank you.
Anastasia, now we need to know about safety.
Good morning, everyone. It is my very special privilege and pleasure to speak here. Thank you so much for inviting me and to represent the United Nations Agency for the Empowerment of Women and Gender Equality, UN Women. And you heard a lot this morning about the new, very important initiatives and aspirations that UN Women now has, that it is larger with the potential for much more influence and change, not only at the level of, here at the United Nations, but also at the ground level, what is happening in the countries, in the cities, and even in the sub-cities, in the neighborhoods and in the communities. Why United Nations Entity for Women decided to start this program, which I have an honor to manage, and it is called Safe Cities, Free of Violence Against Women and Girls. I think there were several reasons. One of the major reasons was that urbanization, unfortunately, does not come with the safety for women and girls. And women, as we heard today in many panels, experience cities in a different way. And it is very important that there are programmatic responses to those experiences. I will just, someone would say, oh, this is maybe just some of the cities, not all of the cities, which affect women differently and adversely and provide a lot of barriers for their participation in the cities rather than the opportunities. But it is a global phenomenon. The research throughout the world has shown that women, the level of fear for example, being in the city outside of their home is very high everywhere. Women in Montreal, according to research by the Women in Cities International, have said that only 40% feel safe outside of their homes. And that means 60% of women do not feel safe. In our research in Quito, many women have said that after 5 p.m., when it is starting to be dark, it is very dangerous to be outside in their communities for them and for their daughters. In Tokyo, 64% of young women said that public transportation is unsafe and they have been groped on the public transportation. And we unfortunately also know that there was a research in New York on a subway here, which also doesn't give us good numbers. So 83% of women in Cairo said that they do not feel safe on the streets of Cairo, and et cetera, et cetera. It is a global phenomenon, and UN Women would like to undertake an effort to look deeply into this problem and to work with the several cities, courageous cities, not those which are necessarily most dangerous. We already know it goes everywhere, but those cities who want to really be accountable for this issue and to try to develop strategies which will work. In November of last year in New Delhi, this global program was launched with the initial 5 cities who joined this initiative. This is New Delhi, Cairo, Kigali, Quito, and Port Moresby. Everyone knows where Port Moresby is? I also didn't know when we started. This is the capital of Papua New Guinea. And regretfully, Port Moresby, every year in a row, is among first 5 cities most unlivable. And unfortunately, the level of violence against women and girls is also very high there. I do not have too much time, so what I would say that there are 3 major messages which this program and UN Women are communicating to participating cities which are engaged in this program. And we call it 3E approaches. The first one, empower. Whatever you do, it is very important that women and girls in the communities, not just big NGOs, which is wonderful, they're very important, but in the communities are those who are empowered, who are not just considered beneficiaries, but actually who are agents of change. And there are methods, there are tools how they could be empowered and how they could be engaged. This is our second E, engaged in change of the policies which relate to their own built environment. And number 3, evaluate. This morning, again, from President Gutman, we heard how it is important to be able to make the case, that to know exactly what works, how it works, under which circumstances, and what doesn't work. It's also very valuable knowledge. So these are the 3 messages which we are conveying through this program and which are very important. And I will just touch upon one specifically related to the built environment and how to combine these 3 messages. There is one tool which is called Women Safety Audits. This is the tool which allows local women to work in partnerships with the local authorities, with other community members, with media, and to look around their environment, their small neighborhoods, to create the map where they feel that they are unsafe, where they feel that there is a danger, and to create the concrete suggestions to the authorities, to place them at the negotiation tables, how those areas could be improved. So it is, of course, professional work, and it is very important that the architects and planners are feminists and they understand and see those aspects, but it's equally important that women from the communities themselves are considered as the experts of their experience and take the equal role in designing the cities which are friendly for them. In Cairo, where this program works, the project has a local name, and forgive me if my Arabic pronunciation is not very good. It is Misrawiya, which means community coming together. Our meeting here is another community coming together. We cannot make our cities safer and healthier for women and girls and for all unless we're coming together. Thank you very much.
Thank you very much. And I think we've seen some very important themes here, one of which is the importance of local knowledge, but also the need to partner with professional knowledge and how we make those bridges. We have a number of questions from the audience, which are just spectacular. We won't get to all of them. And if you're going to ask more questions, please put your email address at the end of the card so we can respond to them. At any rate, we have a number of questions that basically ask our panelists to come down from the clouds and give us some real examples, some real things that you think are exemplary of what you're talking about when you talk about, first of all, define walkable cities, and secondly, what is it? Many of these people live here, many of our audience live here in New York. I think you can give some New York examples, but we're all very sophisticated. You can give world examples too. Margaret?
Yes, well, I began to touch about the interior environment and the stairs. Thinking of a design, if anyone goes into the Apple store in Soho.
The Apple store in Soho, okay? Everybody go.
Not promoting technology.
No.
But it's a stair when you walk in. It's beautiful. It has a skylight. I think you wouldn't think of asking, where is the elevator? You would just go up the stair. And that's the idea. In Cooper Union, the new school there has actually a skip-stop elevator that you can only go to every other floor. I mean, there is another elevator, certainly
no,
for
don't use that.
older
Only
people.
the skip stop. Okay, Cooper Union, Apple Store. Where else should they go?
And then I think the Plan YC has a simple sentence, a park within 10 minutes of every citizen. This has enormous implications, and certainly I would say the High Line.
The High Line.
Everyone here should go see the High Line.
Which the second branch is opening in about a week. So if you haven't seen the first and you want to see the second, get yourself down to Gainsford Street and take a great walk on the High Line. It's one of the best designed public spaces in the world. Done, of course, by a Penn professor. It's James Corner, by the way. Claudia,
Sure.
give us some spaces, places, things.
We have few projects that we have worked for increasing physical activity through pedestrianized areas. I can mention two. One really impressive just happened in February this year in Istanbul, in the historical peninsula, where around 90 streets have been closed to the traffic. And I regret not to have pictures of that, but you can not imagine how people have filled the streets and how important is to recover these public spaces for us, for the people. We are trying to make some measurements just to analyze and evaluate what is the impact of this initiative, but it's really changing. A second project that we have is in the south of Peru, in Arequipa, where also the main street in downtown has been pedestrianized. And before that, people were really against, especially businesses around this area. They protest, they didn't want that. After 2 years, more people, business people, and also citizens are asking for more pedestrian zones. So it really makes a huge difference.
Okay, Istanbul and Arequipa, are you ready for your health tourism? We've heard about ecotourism. We're going to go on health tourism. Okay, Anastasia.
There are a number of interesting initiatives which the program I'm talking about is really very new. So we have initial assessment of what the communities themselves want to propose, how the situation could change. In Port Moresby, in Papua New Guinea, the initiative works in the markets. And markets there are the microcosms of social life. Women make the major of the vendors and the most of the customers as well, though there are, of course, not only women. And they're very often, most of them are also with their children in the same places. So one of the recommendations which women themselves created is to make markets really very family-friendly areas and to have areas where children will feel safe. Of course, the issues of water and sanitation on the markets is very, serious one, as well as availability of the washroom facilities. So women all over the world, particularly those who live in the slum-like situations, the access to the safe washrooms and toilets is huge matter with which we're not familiar with and cannot even comprehend. So they come about with their very creative solutions how to make those areas accessible, safe, and available so that they will stop being the places of rape and abuse. Actually, here in New York, there is also a very important initiative around safety on transportation, which is called Rights Ride. And many of you have maybe heard about that. This initiative is out of Brooklyn, and the women who notice that at night it's very dangerous sometimes for women to come back home, and many of us have to go back home when it's late. after work, after education, or after entertainment occasions. So they now have a number to call that they will be safely transported at the affordable price. It's a volunteer-based organization back home. The creativity which is in women's hands about how to reduce the potential sexual harassment and violence is amazing. Young women also use, for example, there is a website called Holla Back to collect the information about the cases of sexual abuse and violence. Use your phones. We all have phones, many of us, which could be used as cameras. Send the photo of the abuser to this site. So those kind of a very new, or sometimes not that new, different initiatives work to make our cities safer, healthier. Some of them require new investments and partnerships. Some of them are already in our hands.
And in some cities where women's rights are evolving, there are forms of transportation where there are women-only cars on mass transit or on buses or so forth. So there are many, many things that are happening. We have a series of questions that asks you to pay attention to something we haven't paid attention to at the moment, which is the baby boomers. The most recent data we have is that some of them have just turned 65. That is, we're going to have an enormous population of older women. And though we hope that all these older women will climb stairs, they may not be able to climb stairs. So what are some of the fit city design proposals, transportation, safety, et cetera, that you can propose or tell us about for the older population?
Well, it's interesting how in a matter of design you can encourage more walking, even for the older population. For instance, when we work with the Parks Department here and there is a ramp going to a restroom, let's say, which of course we need more restrooms, is a big thing in New York for as our population ages, more publicly available ones, is to have a very gentle slope with benches along the way so that you will be inclined to go out for a walk, but know that there are benches to stop. This initiative of a park within 10 minutes, again, to have benches that are somewhat separated from the pedestrian path so that they feel safe, I think it's very important initiative.
Yes, I would like to mention a very, very important study that has been done here in the city, a pedestrian study. And they have found, unfortunately, that many, many senior people die in the intersections. And when they have looked a little bit more in detail, is because the time of the traffic signs, it can be too short for them, or the pedestrian crossings can be too long. If they don't have an iron when they can stop, take a break, and then feel safe and continue crossing, they can easily get hit. So they are focusing on few intersections with data here in New York to fix that, to just increase the time of traffic lights and also redesign, as we saw in the example in the slide, some crossings. So as one of the speakers before said, it's not rocket science. It's a little bit of sensitivity to look at the data and to make that as a priority.
One of the initiatives supported by UN Women in Dar es Salaam has shown that it is very difficult, particularly in slum-like areas, for older women to walk around because it's very dark. There is no such thing as street lights. So the initiative, because resources are always limited, women decided that it should be the local policy that every house or every, wherever people live, should have, if they have light, it should be on during the dark time so that older people as well as younger people could feel a little bit safer. And I just want to say that those initiatives, of course, are important, but there is a big issue of their sustainability. after one time, everyone was supplied with the bulbs light, but what is happening after those bulbs are gone? So I think we all should think about forward, not only that something is done, something is launched today, but what is happening at the structural level, how much budgets, local budgets, will include the maintenance of those new architecturally sensitive inventions in the cities. So I believe that this is something which we all need to consider. It's not one-time thing done. It's looking forward.
Thank you very much, panelists. This is an incredibly profound subject. We've got all these questions we couldn't even answer. You'll get answers by email, but they range from everything from why can't we do what Paris does with rental bikes that anybody can take, to does anybody know about Medellin with the ski lifts that take people into the slums, to what about gentrification? What about many other things? At any rate, I thank you, panelists, for beginning to open our eyes for this very, very critical linkage between women's health and cities. Thank you very much.